Hi, my name is Michelle Hansen, and I'll be recording my project for my Doctor of Nursing Practice project at A.T. Still University. I would like to thank Dr. Segura, Dr. Lunt, Dr. Webb, and Dr. Saunders for your help and input in creating the project and writing my paper. I'd also like to thank Ms. Lukowicz for being my preceptor at Oakwood Creative Care. Without you, I wouldn't have been able to do this, so thank you. Oakwood Creative Care is a respite center for caregivers of loved ones with dementia. Caring for older people in their environment, or COPE, is a program offered by Oakwood Creative Care that trains caregivers how to safely care for their loved ones in the home. The practice issue is a need for a quality improvement project, specifically the need for an evidence-based formal discharge planning process. The issue was discovered through meetings with stakeholders at Oakwood Creative Care and through a SWOT analysis. Lack of a formal discharge planning process is a problem because research shows that having a high level of self-efficacy reduces stress in caregivers of people with dementia, lowers depression, and improves quality of life. A proper discharge plan can increase caregiver self-efficacy and prepare the caregiver and client to continue what they've learned after the COPE program ends. The COPE program at Oakwood Creative Care had no evidence-based formal discharge planning process, leaving caregivers with a lack of resources, support system, or plan. Using evidence to create a discharge planning process provides resources and contact information so that caregivers are confident in their ability to care for their loved ones with dementia. This project was a quality improvement on the current discharge process. The project had a meso-level systems focus because it was a healthcare institution level quality improvement. The meso system ties the micro and macro systems together and looks at quality improvement initiatives or translating data into administrative decisions. The meso system is larger than the individual patient, but not large enough to be macro. It looks at a quality improvement to help multiple people in one organization. The situation leading to the project was a gap in an evidence-based innovative discharge plan for caregivers graduating from the COPE program. Oakwood Creative Care has an innovative version of COPE. The staff have created a dementia hub where caregivers can come for resources and information. Part of the goal of the discharge planning process was to compile all the local resources for people with dementia and a location for caregivers to come for those resources. The first objective was for the researcher to collaborate with the COPE-based team, which was an occupational therapist and a physician's assistant, to develop an innovative discharge planning protocol that can be used to implement best practices into the innovative COPE-based model. The purpose of the objective was for the staff to review what was missing from the discharge plan and improve it to ensure that caregivers have what they need when the COPE program ends. The second objective was to modify the current caregiver self-efficacy survey that the COPE program uses to include qualitative questions to be asked before and after the COPE training. The purpose of the second objective was to improve the current survey to provide more specific data on if the discharge plan improved self-efficacy in caregivers. Third objective was to reduce caregiver stress and increase caregiver confidence in being part of the discharge process, which was measured by the caregiver self-efficacy tool before and after the training. The plan was to increase caregiver self-efficacy, which is essential because high self-efficacy levels can reduce stress and improve the quality of life in caregivers of people with dementia. The fourth objective was to complete a local resource list for caregivers to be provided during the discharge process to ensure caregivers can find needed resources when on their own. Caregivers of people with dementia often need resources unexpectedly, for example, adult-sized diapers, medical equipment, and respite care. If they know where to find these resources and services, then their stress is reduced and they can provide better care for their loved ones. 20 articles were analyzed as part of the literature review. All resources used for the synthesis were evidence-based on peer-reviewed sources. The level of evidence of the 20 articles were mostly rated as high quality due to sufficient sample sizes, definitive conclusions, and consistent recommendations. As far as the levels of evidence the articles reviewed, one article was level 1 evidence, 1 article was level 2, 12 articles were level 3, 1 article was level 4, and 5 articles were level 5 according to the Johns Hopkins Level of Evidence Scale. Most of the studies did not have any bias, and most were discovering ideas that had not been researched yet regarding caregivers of people with dementia. There's still a lot that can be learned about how best to increase self-efficacy among caregivers. The search for the literature review used CINAHL, PubMed, and PsycInfo. The analysis included grouping the information found into themes. The research clearly showed that the COPE discharge planning process should include psychological resources and coping strategies, access to support services, and information to increase social support systems. Patient-centered care was integral to the discharge planning process. The literature showed that it was vital to listen to the caregiver and patient needs and consider their values and desires in creating the discharge plan. Literature showed that professionals should evaluate caregivers for needed skills training, information on palliative care, and end-of-life decisions, as well as local community resources. If possible, healthcare professionals should connect caregivers with support groups and online training modules. Using theory to guide the quality improvement project was essential to the planning process. Theory ensured that the quality improvement was based on proven methods to provide the best care possible. Dr. Deming of the Deming Institute created the Plan, Do, Study, Act model, and the PDSA model is a way to develop and implement a change and then evaluate the outcome of the change. The change can be improved, implemented again, and reevaluated as often as necessary. The PDSA model is commonly used for quality improvement projects and was chosen because it can be used to guide the change, analyze data, evaluate the change, and then modify the change as needed. The Agency for Healthcare Research and Quality created an evidence-based discharge process called the IDEAL discharge process. IDEAL stands for Include, Discuss, Educate, and Listen to. The discharge process involved educating the patient and caregivers, discussing 5 key areas to prevent adverse outcomes at home, and educating the patient and caregiver using their health literacy level, current skills, and preferences. The discharge process also involves assessing the patient and caregiver's understanding of the education and listening to their goals, preferences, and concerns. The mission of Oakwood Creative Care is to enhance the quality of life and spark joy for older adults with cognitive or physical challenges. The organizational strategic initiative includes providing innovative care and solutions to keeping adults with dementia in the home by supporting and training their caregivers. The COPE program goes into the home and trains caregivers and patient dyads in their environment. The program decreases anxiety and stress for the caregiver, provides needed resources, and promotes safety to keep the person with dementia in the home and out of the hospital or care settings. The COPE program is new and has been around since 2022, so not many caregiver patient dyads have completed the program yet. Data to support the change was qualitative and based on interviewing the director of the COPE program and the director of Oakwood Creative Care and through evaluations by caregivers. To assess the needs of the facility, a discussion with senior leadership to review the program's needs was completed. A separate formal interview was also completed with the director of the COPE program. And the directors discussed that because they're using money from a grant that requires innovative and evidence-based solutions to problems, an evidence-based discharge transition plan would align with the organization and grant goals. Because the focus was on preparing a nurse for leadership, the project aligned with the Graduate Quality and Safety Education for Nurses, or QSEN, competencies. The QSEN competencies were created by the Institute of Medicine's National Advisory Board and include patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety and informatics. The competencies that most align with this DNP project were patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, and safety. The Doctor of Nursing Practice Essentials document was created by the American Association of Colleges of Nursing in 2006 to provide recommendations about how DNP nurses should be trained and what they should be capable of as nurse leaders in the profession. DNP Essentials 1, 2, 3, and 6 were addressed by this DNP project. Scientific evidence from an extensive literature review was used to determine the best evidence-based discharge plan for the COPE program. I used the PDSA theory to create the discharge planning process. As prescribed by Essential 2, I conceptualized a new care delivery model for the COPE caregiver-patient dyads, which was based on contemporary nursing science and feasible in the current economic environment. Evidence-based practice was used to create the discharge planning process by carefully analyzing the literature to find the best methods for discharge plans in alignment with Essential 3. I used research to determine the best strategies to increase caregiver self-efficacy. Knowledge learned from the evidence was used to create an evidence-based discharge plan for COPE. For Essential 6, I worked with an interprofessional team of an occupational therapist and physician's assistant to create the discharge planning process. Effective communication methods and collaboration skills were used to work with this team in developing the discharge plan. The population included adult caregivers of loved ones with dementia in the home participating in the COPE program between March 15th and August 1st of 2023. The occupational therapist and physician's assistant completed the interviews before and after the COPE sessions via email. The population included any race, age, and gender willing to participate in the quality improvement project. Each caregiver had an explanation provided regarding the project. The caregivers enrolled in COPE at the time of the project were all caring for a spouse in the home. An exclusion criteria included those not enrolled in the COPE program or those enrolled and unwilling or unable to answer the survey questions. The grant provided money for the COPE program. The grant has specific stipulations for reporting and criteria for what they want done. One of the criteria is innovation, which helped with the project being a new discharge planning process. This project did not cost any extra money and is not generating any revenue. Resources needed included a laptop, internet access, and COPE staff. The staff met with the caregivers, collaborated on the discharge plan, and sent the surveys to the caregivers. Surveys were sent out electronically, and the responses were returned by email. Qualitative questions were asked before the COPE training and after the COPE training. These questions were analyzed using thematic analysis. An example of questions asked before the COPE training include, what type of information would be most helpful for you to receive at this time? An example of questions after the COPE training included, what part of the COPE program was most useful? Quantitative data was collected using self-efficacy scales rating 1 to 5 before and after the COPE training, and then a t-test was used to analyze the quantitative data. The AHRQ Ideal Discharge Plan was used to create a discharge plan specific for the COPE program. The project required collaboration with the COPE's program manager and physician assistant and with input from the Oakwood Creative Care Director. The COPE director met with me to develop the survey questions and the discharge planning process. The implementation design included a pre-COPE survey that was emailed out to caregivers. The discharge plan was created in collaboration with the COPE director and implemented after the pre-COPE survey was completed. The Caregiver Local Resource Guide was created and implemented as part of the discharge planning process. The resource guide was used with the discharge plan to prepare caregivers better to care for their loved ones with dementia. The self-efficacy assessment was administered to the participants before and after the COPE intervention. The items were scored on a 5-point self-efficacy scale from 1, not at all confident, to 5, completely confident. And 2 of the 7 participants did not complete the post-intervention assessment, and a paired t-test was conducted using the responses of the remaining 5 participants. The results are presented in the slide shown, and the participants reported a significant increase in their overall confidence level in understanding the needs of persons living with dementia. Participants were asked what information would be most vital for them to receive during the training, and the responses are shown in this table. Some needed help with activities of daily living. Some needed help with anger of their loved one. Some needed information on respite care or how to keep their person safe in the home. And one person asked for information to give to their adult children to get them more involved in assisting with care of their loved one. All 4 objectives were completed. An evidence-based discharge planning protocol was completed. The caregiver self-efficacy survey was modified. Caregiver stress was reduced and self-efficacy was increased, and a local resource guide was created. There were some unintended consequences. Initially, the plan was to survey about 15 caregivers before and after the COPE training, but due to the number who applied for the COPE training, the final number was much fewer than anticipated, with 5 participants total. One unintended consequence is that it might have been a burden on caregivers to answer the post-COPE survey, though none of the caregivers mentioned this. Positive consequence was increasing caregiver awareness and therefore readiness to change by completing the training through answering the survey questions. And Oakwood Creative Care staff stated they also gained more awareness of evidence-based discharge processes. The COPE program was provided grant money for 3 years, but once that money is gone, they will apply for other grants or do fundraising. They're already implementing Medicare and Medicaid billing codes in the discharge plan to begin the reimbursement process, and that will help with sustainability. Recommendations for future projects include using a different evaluation method to determine the effectiveness of an evidence-based discharge plan, performing the same quality improvement project over a longer time frame and with a larger population, and using a more diverse population. Recommendations for nursing practice are implementing more programs such as COPE to train caregivers in the home. As the population increases in aging and more family members care for loved ones with dementia, in-home training can decrease caregiver stress and lengthen the amount of time people with dementia can stay in their home setting. More programs in which the caregiver has a support system and a contact to reach out to with questions would be helpful. Thank you for listening.